Now I call upon our chief guest, our national president, Dr. Balavenkatasubramanian, to give his speech.
Respected President of Tamil Nadu State ISA, Dr. Kribakaran, Secretary Dr. Srinivasan, Academic Chair Dr. Selva Kumar, the CEO Dr. Amudha Rani, the President-elect Dr. Rajkumar, the Organizing Chairman of this event Dr. Saravana Kumar, Organizing Secretary Dr. Arun Pandian, past presidents of the National who did proud to Tamil Nadu by leading the country, Dr. K. Balakrishnan sir and Dr. Ranganathan sir, all the galaxy of past presidents of Tamil Nadu State, all the invited faculties who have come from within Tamil Nadu, outside Tamil Nadu to enrich this conference, to all the young postgraduates, sincere thanks for being part of the state meeting. At the outset, on behalf of all the National Governing Council members, I extend a sincere thanks to the Tamil Nadu State for doing excellent academic activities and activities for the well-being of anesthesiologists. Please accept our warm wishes and congratulations, and I'm sure you will continue to motivate people, inspire people to make ISA in this state very vibrant, reactivate all those city branches which needs that extra push to show their activities, and we are very happy. So I convey my best wishes on behalf of the National GC. And I'm extremely stunned and amazed at the way Erode City Branch has done this meeting. Heartiest congratulations to the entire team. I think this looks like a family function rather than a function organized by a city branch. It shows the closeness, the proximity of how each one supports each other in this industrial city of Erode. And I want to congratulate you for several things, because the pre-run for the conference, they started several months ago, and they kept on bombarding the social media with a lot of relevant things, which was very academic. Thank you for these innovative things. And the minute you entered inside, it was designated 7:45 a.m. for the flag hoisting. At the dot of 7:45, the flag was hoisted. Thank you so much for doing with such a precision. Throughout the world respects people who respect time, and I'm very happy Erode is a front runner for doing this in starting on time. And I was also very happy to see that when the flag was hoisted, in several places where I go, it will only be few of the ISA leadership present during flag hoisting. But here, I saw a large number of Erode ISA city branch members being present. They were not only present, all the men were wearing uniforms, the brown shirt, and all the women were wearing the uniform that they chose. So we saw a large delegation which showed that they wanted to be a united force ever, and the color of their sari and the shirt showed that they stand together in all eventualities. So a very big applause to the Erode team for very thoughtfully doing everything. And you got surprised when you went for registration counter. All that you have to show is, you have to show your beautiful face to the phone, and the phone register you for the conference. Face recognition, and so it's not stopping with AI in anesthesia. It is showing how AI and technology can be incorporated into your conferences, and you did a stellar performance for doing this wonderful registration. So on behalf of each one of us present here, I wanted to heartily congratulate Erode for all the efforts and the pain that they've taken. And I think for this, I would request a standing ovation from all of you for the Erode City Branch for doing this conference in such a vibrant manner. Thank you so much. And also I was very happy that the oration was delivered by Dr. Muthukrishnan, who mentored several young anesthesiologists of the city. And I'm very happy that Muthukrishnan made sure that he honored his mentor, Dr. Rangasamy sir. So I think this clearly showed the networking, and a hearty congratulations again to the Erode team for doing this so very well. And the pearls of wisdom that emanated from Muthukrishnan sir's oration. Oration cannot be predetermined that it has to have slides, it has to have English language. The message that it conveys is possibly more important. Throughout the world today, because as I serve as the Secretary of the World Federation of Society of Anaesthesiologists, every month I get a report about what is happening to several parts of this world. Believe me that several deaths are happening throughout the world because of lack of anesthesiologists in private practice. Throughout the world. So cesarean sections, antenatal deaths, postpartum deaths, maternal mortality remaining very high is happening because in several countries it is only the government-run hospitals or the sole healthcare providers. But India made a huge difference, and current statistics shows 80% of surgical work in India is done by private practitioners. So a heartiest congratulations to all the private practitioners, and Erode forms a testimonial of private practice. And I'm very, very happy that you enumerated the importance of the private practitioners, and a oration can be delivered by a private practitioner. When I speak about this, I also wanted a request, like what Muthukrishnan sir says. Orroru life-um romba mukkiyanga. It is so important. Every patient whom you anesthetized, there is a husband waiting outside, there is a child waiting outside to see the mother. So every life is crucial. Now, I wanted, as a national president, to share with you several mishaps that are happening even today. Every day you keep hearing about death, 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 death. This is a very sad state of affairs, and we really, really need to not just speak in the stage, but just get into the nitty-gritties. Do you know that within the last 2 months, 3 deaths happened in this state because of intrathecal drug administration, which was not local anesthetic? Do we know that 4 deaths happened last month across the country because young individuals dying because no dantrolene was available? So, are we doing justice to what we are supposed to do? Can we accept a death in our family because of medication errors? And I am so surprised and shocked. Sometimes also this happens. I'm going to quote this because it's a group of anesthesiologists. Here is a young boy, 24 years old, finished his engineering, just got a job in a software company. On a Saturday morning, his kid in his house fell down, heard a shoulder dislocation, went to the nearby hospital. They said this is only shoulder dislocation. Mother was there, father was not there. There's only a shoulder dislocation. It's a very small procedure. Just wait. It's a small nursing home. So then an orthopedic surgeon, I don't want to mention the city name. The orthopedic surgeon and the anesthetist came. And this is what I now want to convey. This is the modern era. We are talking about technology. We are talking about artificial intelligence. We are talking about robotics. We are talking about liver transplant. Now I wanted to say what Muthukrishnan sir said, small case. And what happened here, this anesthetist and orthopedic surgeon came together, and he gave a block. And the surgeon wanted to reduce it within few minutes without even knowing the block has taken or not. The block had not taken. And the patient went into profound spasm, bronchospasm. And the worst part is, he was not put an IV cannula. No IV cannula was put, and after this happened, he started hypoxic. He became hypoxic. He started IV line. Tried to start IV line. There was no help that he had because most of the staff that were inside were not qualified, and on table death. So this raises the question, where are we? Or does all our patients get what they actually need? This raises the question of integrity to the whole process. And unfortunately, the sequence followed. They intubated the patient. They told the mother that he's very sick and shifted to a multi-speciality hospital. So now I wanted to raise a question. This calls for introspection. Can we lose a 24-year-old young boy with a shoulder dislocation in this modern era of medical practice? And also I wanted to ask the question, I am very happy that 80% of the work is done at private. Majority of the private practitioners now have clear protocols, extremely skillful, but even today, I want to narrate one more incident. Private practitioner, tubectomy, 26-year-old, third gravida, fourth day, they decided to go for puerperal sterilization, spinal given, procedure over in 15 minutes, anesthetist left because it was spinal. They were asked to shift the patient. This hospital did not have a post-operative ward, shifted to the room, and the old mother went to wake her up after about 2 hours to feed the child, and she found her dead. So now if you introspect, the anesthetist left even before the patient was shifted outside. Spinal was given and the procedure got over in 15 minutes. Since 50% of the local anesthetic injected does not fix to the receptors even up to 30 minutes, when they shift, it's an hyperbaric solution, it had gone high, total spinal and death. I wanted all of us to introspect. The 3 children were permanently have to grow without a mother who never had any disorder. Are we doing justice to what we are doing is the introspection that we need to do. The 24-year-old boy, the 26-year-old mother left the world because I want all of us to introspect. It is extremely crucial and important as we grow and as we progress. Every single anesthetist that we give should possibly get the best. And I have several stories I keep hearing every day. It pains me a lot. And if you come to positions and responsibilities, you're immediately called because now they wanted to know what will be the legal advice. So that's why you keep hearing all these statements. And it pains me and it really affects me a lot. So my humble request, whether it's private practice, whether it's corporate practice, whether it's a medical college practice, I think the norms should be the same. And the private practitioners are challenged more because of poor infrastructure, no post-operative ward, no educated staff to help them in the post-operative ward, and hence I request them to be more vigilant, more careful, and make sure that they shift the patient to the post-op and make sure the hemodynamics are stable and make sure what expected complication and what it has to be done before they leave the hospital. And also a request for them to train all the staff nurses in resuscitation. I think if this conference, if it has to teach us few lessons which will result in our introspection, which will make a change in our practice, I would request that please educate. If you are going to small hospitals, 4 hospitals or 5 hospitals, please take up the responsibility to teach, whether they are educated, whether they are qualified, whether or not. Please educate them with the basics of resuscitation. I think this is a big step forward in preventing every single death that can happen. We are all blessed to be born in this country. I just wanted to share 2 stories to tell you why we are all so blessed as an anesthetist. If you see the growth curve of an anesthetist in this country, none of them starve. Everyone graduates both materialistically and financially. 5 years, there is a car. 10 years, there is a home, a flat. 15 years, the flat becomes a villa. And sometimes villa become multiple villas. There is no single anesthetist in this country who starves. So we are truly blessed of being born in this country. Now I will share with you 2 stories. We are a WFSA Regional Anesthesia Fellowship Center since 2014. So we get trainees from outside India. I don't want to mention the country. This is from Africa. This trainee came in, and 1 month into it, every day when he comes, we have a common dining room. Morning, he used to take tea. Afternoon, the tea comes, and the biscuits are there in the theater. He will eat biscuits. So initially, I thought that he doesn't like Indian food. After 1 month, when I was eating with him, I said, Dr. Cabo, why is that you are just taking tea and biscuits? Why are you not taking? Can I call the chef and ask him to provide you the food that you want? He said, no, it's not because of that. The country which I work in the government hospital. I get a pay. I have my wife who is not working. I have 3 children who go to school. So I don't have a house, so I have to pay the rental. So to look after my family from the money that I get, I can afford only 1 meal a day. And so I'm used to taking only 1 dinner. And just because I'm getting a stipend here, if I spoil my tongue and my requirements, when I go back, I won't be able to get the same thing. So I will continue to eat only the dinner. Where is he? Where are we? One more story. Another person from Africa, almost 2 months into the training. One morning, he was sitting in one corner of the pre-operative room. He was supposed to come only at 8 o'clock. When at 6:30, when I entered the pre-operative room, he was sitting quietly in one corner, very gigantic. I went to him, Oboko, why are you sitting here? You're supposed to come at 8 o'clock. The next thing what he said startled me. He said, my wife is dead. I said, what are you talking? Your wife is dead and you're sitting and crying here. And why you didn't go? When it happened? He said, last night. Why you didn't go? You know what he said? This WFSA fellowship, I was waiting to learn regional anesthesia for 2 years. And WFSA gave me the money to come, otherwise I didn't have the money to come. You're giving me stipend. I came with the purpose to learn regional. Now, if I go back, 4 more months are left. If I go back, I wouldn't have learned regional properly. And I can't come back again because I don't have money, because there is only one return ticket. Anyhow, she is dead. Her wife is there to cremate her, and she doesn't know that I didn't come for her cremation. So I decided to stay. I cried a lot, but I decided to stay. Where is he and where are we? The world is not the same for all of us. The world offers different things to different people. And he's also a colleague, he's also an anesthesiologist. But eventually, we spoke to the directors, gave him the money, and we told him, she may not know that you didn't come to her funeral, but for your entire life, you know that you didn't go to the funeral of your wife. But I just wanted to share that how people wanted to learn something which is not available to quench their thirst of skill and the knowledge, and they go to this extent and see how blessed India is. So many workshops, so many meetings, so many conferences, so many ways to skill develop. So now the question is, are we using the available resources adequately to make ourselves more capable and skillful? When we attend a conference, do we sit inside and listen to the lectures? All are such fantastic talks giving the latest updates. If I learn 2 points from here and I put it on my patient, several patients will live. Do I go to the workshops which are conducted in Erode on point-of-care ultrasound, peripheral nerve blocks? It was a great opportunity. The learning come to the doorstep. And now a question needs to be asked. This teaching is not only for postgraduates. It's for every single anesthesiologist to learn from what is happening new and try to implement in their practice. So a conference is an academic temple where it gives an opportunity for us to learn new things, which will become a part of our practice, which will result in preventing morbidity and mortality to hundreds of patients whom we anesthetize. Even if the whole year, if you don't read, if just the 3 days or 2 days you dedicate yourself and listen to the talk, I think India will be a better place to live. I always take a cue. I've attended 12 American Society of Anaesthesiology meetings. Why are they leaders and why are we still the followers? Why do we quote American Society of Anaesthesia for everything? What is their meeting and what is our meeting? The latest meeting which I went last year was in Philadelphia. Do you know the attendance? 12,484 people, 36 halls. Session starts at 7 in the morning. And you see the hall full all the time. Why? Why is that they are like that? And why should not this happen to this country? It is not the quantity that is important, it is the quality that is important, and all of us have to strive towards this. And I'm extremely happy that majority of the ISAs, city branch, state branches are doing regular academic programs, but it's a call for introspection for each one of us. Am I doing justice to my professional life? Am I the best? Can I do the best to my patient? In my presence, a patient should not die. For me, life is more important than the money that I get out of it. Money is equally important, but life is more important, because there is a big family waiting for this patient outside. So I humbly request, I take this as an opportunity to share those painful moments that you listen, those painful episodes that you come across almost day in and day out, to see the implications of what happens to several patients in this country. But I am extremely confident that together, we can achieve, we can accomplish. And we can show the world that we are no way inferior to any of them. And I also request, I'm very happy when you announced that you are starting a state app. This is a humble request. When do a person become proud as an anesthesiologist? Apart from the materialistic accomplishments, it is publication, presentation. So if all the private practitioners in Erode use this app and say that in the month of this particular month, I did 440 cases. My incidence of postoperative nausea, vomiting was less than 2%. These are the medications that I used. And if this integrated data is taken by the state, and if you present it to the country, in the whole of the state of Tamil Nadu, this was the percentage of postoperative nausea, vomiting. This was the incidence of failed spinal. This was the incidence of PTPH. This was the incidence of a particular shivering complication. I think we'll be the first state to do that, and I request all of you to make sure that you propagate it to the entire city branches. Make all the city branches do this, and similarly the checklist and the form before you start the case, and in the case and after the case, the W checklist. These are small additions that you can do to the practice to make sure that we are moving towards a path of excellence and patient safety. Before I conclude, I wanted to share that October 16th is the Anesthesia Day. And since last year, we have decided to celebrate it for 1 week. And so from this year, it will be from October 10th to October 16th. Soon, the state president and secretaries will get all the intimations regarding this. And we have also taken a cue that each anesthetist in this country, registered with ISA, 50,000 anesthesiologists in this 1 week will do one surgery free of cost to a poor patient. So we wanted 50,000 poor patients in this country to get a free anesthesia as a token of our respect to the economically downtrodden. So this is something which I would request, and we will share it with the state president and secretaries to implement this. I also wanted to share that a happy news is the president of Indian Society of Anaesthesiologists is a part of the central government initiative of critical care ecosystem of safety in the hospital. So an expert committee was formed, and from this year onwards, whoever is the president of Indian Society of Anaesthesiology is a part of the expert committee of the central government Niti Aayog, which was formed by the Ministry of Health. And I had the pleasure to represent this year, and it was a revelation that when I went to Niti Aayog, I realized there is a big think tank that is working to push this country forward. And unlike the government officers, I saw all of them coming in at 8 in the morning and they leave at 8:30 in the night, fully focused and concentrated on this. And this is a very big step forward of recognizing anesthesia at the national level. And I'm very happy that the future presidents will represent anesthesia. We utilize this opportunity to bring forth several of the issues faced by the anesthetist, including the PCPNDT Act, which is very stringent. And along with the Consortium of Accredited Hospitals of India, we have brought a consensus statement, which was ready yesterday following a big webinar. And now, through Niti Aayog, we are going to present it to the Health Minister of India, J.P. Nada. We have got an appointment with him in the month of August. So the office bearers of Indian Society of Anaesthesiologists will present this consensus statement on PCPNDT Act and its implications to anesthesiologists, especially in private practice, to the government. I think this is a big step forward in making sure that ultrasound is available to all of us. And we have taken one more initiative. We will start it from Uttar Pradesh, where the maternal mortality is very high. So the state of UP, ISA, in conjunction with the government of UP, we have spoken to the Health Minister of Uttar Pradesh, and the plan is all the high-risk obstetrics in the government unit in the blocks where the maternal mortality is very high, the city branches will send one qualified anesthetist to that block and make sure that the anesthetists are supported in that and to decrease the maternal mortality rate. I think the same thing we can implement and follow in our state as well to find out the blocks where maternal mortality is high, and the city branch which is close by should help the government anesthetist in high-risk obstetrics like one day in a week or one day in 2 weeks. Finally, before I conclude, I wanted to repeat ISA Family Benevolent Fund. It was very nicely enumerated by Muthukrishnan sir, and this is the biggest support that we can give to a person who loses his life suddenly. Girish Kumar is an example, who was a dynamic 41-year-old young ISA official of Telangana. Never ever his wife thought next morning she will be devoid of him. Died of a massive attack, and the whole family need to be supported. It's a humble request that it costs very, very less. It's a big way that you can support a fellow anesthesiologist who suddenly loses his life. I would strongly recommend Erode, just not only this conference, make sure that every member of Erode is a member of ISA Family Benevolent Fund. And also the state, please work on getting everybody involved in ISA Family Benevolent Fund. At the national level, we wanted that all those who want to take leadership positions should be member of ISA FBF before they apply for any particular position in ISA. And to conclude, we have several senior anesthesiologists from various parts of the country who are here to meet all of us because they want to serve ISA. The ISA elections are going to come from August 1st to 5th, and I'm very happy that there are so many people who are ready to serve ISA and want to take ISA forward. So please greet them, please respect them, because taking these positions means a lot of travel, lot of money, lot of stress. But in spite of their clinical work, they've all come here to meet you, to share our responsibilities, and to give solutions to our challenges. Wishing all those who are contesting our best wishes on your journey to serve ISA. But I am extremely confident that together we can accomplish a lot. ISA can match ASA. ISA can become one of the best organizations in the world, and let us march towards that with power and grit. Thank you so much. Long live ISA. Jai Hind.